Thank you, Krista, and thank you to our audience for taking 20 minutes out of your very busy schedules to learn more about our financial assistance support program. I saw some familiar names on the registration, so hello, friends. For those of you that don't know me, I am Christy Vago. I lead the business development for Upland Advocacy, and I've been in the industry for about 3 decades. Most of my career has been with TPA operations, relationship management, and leadership. I also have experience in stop loss and risk assessment. But in the last 10 years of architecting value-based plans with my consultants and clients, I didn't hear anyone talking about hospital bill relief. My goal in our time today is to educate you on the Upland Advocacy Financial Assistance Solution because I believe it'll benefit you in 3 ways. Number 1, there's producer commission baked into our pricing. 2, this added solution in your toolkit may help you win that next BOR and separate you from the average broker. And last, you can change the financial future of the employees that you serve and have an even higher impact with your clients. So let's dive in. Upland Advocacy is addressing the epidemic of medical debt that's running rampant in the United States. It's no surprise. We all know that healthcare costs have been rising year after year. And unfortunately, it's the employees that get stuck carrying much of the financial burden with high deductibles and out-of-pocket limits. The Kaiser Foundation released a study last summer that was eye-opening to how many people are impacted by medical debt. Kaiser estimates that 100 million people, that's 41% of adults in this country, are burdened with medical debt. Half of them are in collections. Now, this situation is driving bad behavior. Kaiser states that 1 out of 3 people are delaying care. They're not picking up that prescription. They're not seeing a doctor. They're not getting the surgery because they don't think they can afford it. And these are the people with a health plan. Now, there's also the challenge of access. There's still 30 million people in this country that don't have access to a health plan, and those numbers are only going to go up. We know that the COVID relief regulations are expiring and auto enrollment for Medicaid's going away. So there'll be millions more of people challenged to find alternatives, reapply for Medicaid, or unfortunately go without. We know this is a problem, but do you know relief is available if you know where to find it? Upland Advocacy is harnessing the power of the 501(r) mandates found in the Affordable Care Act. Now, this has been around since 2010, but like I said, I just don't feel people are talking about this. 501(r) mandates that nonprofit hospitals give back free or partially reduced costs of care into the communities that they serve. The eligibility is very clear. It's hinged on the number of people in the household and the average income of that household based on a federal poverty level. So we've identified over 4,000 nonprofit hospitals that need to be held accountable to give this care back to their communities. In addition, many for-profit hospitals are coming to the table to negotiate as well. So the opportunities are even greater than this $4,000 number, 4,000 hospital number. Here's our mission. Upland connects employees to the financial support they deserve so they can get the medical care they need. We support our clients in 3 different ways. First, we're finding these financial assistance programs and connecting people to this relief that's available to them. We're helping them apply. It's a cumbersome application, if you can imagine, but financial assistance is our first strike to help the most people in the largest way. Now, sometimes they make too much money or the time expiration has happened and they can't apply for financial assistance. We'll come in at the second level of our service and negotiate. Our advocates are trained on how to talk to providers, how to negotiate their out-of-pocket down, single case agreements. We have all of the skill sets to get that amount that they owe down, if not completely erased. And last, we know that 50 million people in this country are in collections due to medical debt. We'll help support that member wherever they are in that collections process. Sometimes it's writing the next letter. It's often just making sure their rights are made known and we help them fight for it. But the idea is to pull them out, move towards settlement, and get that financial burden lifted from their shoulders. As you listen to this solution today, please keep in mind that Upland is agnostic to the underlying health plan. We can work with fully insured plans or self-funded plans. We can work with clients that have a PPO network or are in reference-based pricing. Now, the unique part about Upland is we can also serve all the employees in a population. So we're looking for the part-timers, the folks that can't afford the health plan, those that maybe are on spousal coverage. We can help be a benefit that an employer can offer their entire population. What does this relief look like? In my experience, I always thought hospital charity care was for the homeless person that stumbled into a facility and the hospital just had to write it off. It's not. It's far from that. This relief is for the average American, and the support can be life changing. We ran 10,000 lives through our proprietary algorithm, and we found that almost 50% were eligible for some type of bill relief. 25% of our sample was eligible for free hospital care. This is for real people making real money. So let's go into putting a face on what this looks like on two different demographics. First, Ellie is a waitress, single mom, two kids, making $43,000. Ellie chose not to fill her prescription because, like so many other Americans, she has to choose which bills to pay every month, and she had to pay for after school care. We all know that not taking that prescription month after month is going to get Ellie sicker, cost more to the plan, and most likely she'll be out of work longer. Let's look at Tyrone. He's married with two children, so four people in his home with an average income of $58,000 in that household. Tyrone is in collections because of surgery he had to have to walk. Tyrone was eligible for free care and didn't even know it, just like Ellie. This is real relief for real tax-paying Americans. The next question I get is, well, how does Upland interact with members and employees? And my answer is all the ways. We get creative, but first, our first swing is through our proprietary algorithm that I mentioned before. We can identify through the household size, enrollment levels, and salary which people are most likely eligible for free or partial relief from their hospital bills. We reach out to them proactively, make sure they know who we are, how we can help them, and when they are challenged with a hospital bill or know that they're going into a hospital, to contact us. Second, regardless what TPA or administrator you work with a claims report, we can look at the out-of-pocket as soon as the claims are paid to know which members have maybe just too much on their burden to pay. We usually chase down claims over $500 or more because that's where we believe we can bring the most relief. Last, we work with everyone that's supporting that health plan, whether it's a concierge, nurse navigator, a clinical team, really anyone that's touching the member in their journey to know, oh, I've got someone that sounds like they're challenged with their bill, going into the hospital. Let's get this over to the Upland team. Last, we try to be creative. We've got QR codes in all of our materials. We have a short video that explains what medical debt is, how we can help people. And if you feel you're one of those people that has a bill you can't afford, click on the code and it comes right into our team. So again, we'll work with however the client wants to communicate through posters, mailings, postcards, and all of the fun ways we try to get out in front of membership and communicate value in our program. Once we connect with that member that needs our help, they are assigned a personal advocate on the Upland team, and we really step in on their behalf. We're then talking with their providers, facilities, anyone that's sending them to their bill to help either, again, our three ways. Financial assistance is the first swing, negotiating if they're not eligible for financial assistance, and then, of course, helping in that collection process. Depending on where they are in their journey, we're there to help. Let me take a moment to show you what this looks like from a member's perspective and go through two case studies with you. Sandra had a head injury and had a $6,100 EOB in front of her. Now, this is the average amount a normal person has with a high deductible plan. The plan paid correctly, plan pays first, and she had a $6,100 bill. She started paying it off to the facility, but unfortunately fell behind and they took her to collections. This is when Upland met Sandra. We helped her apply for financial assistance. She was approved. And not only did we remove that $6,100 bill that was hanging over her head, we were able to get a credit back of the $1,200 she had already paid to the hospital. See, Sandra was eligible for free hospital care and should have never been charged the first hand, let alone they take her money. This is the type of financial release we can help and change people's lives and trajectory with removing that whole bill from her account. Now, Astrid, unfortunately, is going through cancer treatments, $3,000 a pop. If you've ever had cancer hit a friend or a family, it's a very difficult journey. the last thing you need to be thinking about is how are we going to pay these bills? This is where we found Astrid. We helped her apply for financial assistance. She was approved. And again, this is where we can even go further and help plan benefits. So listen to this. We were able to resolve the $3,000 cancer treatment bill that Astrid was looking at. But when these hospitals write their financial determinant letters, they are covering that family, that member based on eligibility for the length of the treatment. So for Astrid and many others, this was a letter that was good for a year, that no future cancer treatments would be charged to Astrid or her plan. So we're now impacting future claims based on this financial assistance that's on the table and available for most Americans. So let's talk about the benefits of Upland Advocacy. We wrap very well with MEC plans and high deductible plans. We're an additional advocacy service to help members that are challenged with hospital bills. If you think about the industries that we're most prevalent in, think food and beverage, manufacturing, construction, wherever there's those large populations of folks that, again, don't have a health plan to turn to. We can be a support for all of them. We're also addressing this delay in care that Kaiser pointed out. We want people to get the care at the right time, at the right place, and certainly tapping into the financial assistance that may be available to them. And then employees, it's easy to see that value. They're getting an advocate that's fighting on their behalf, that's maybe reducing or eliminating their medical debt and giving them a financial freedom they might not have had otherwise. Now, a few housekeeping logistics before we wrap up. Our target industries I mentioned, think of populations that have a lot of part-timers, maybe are prevalent in the blue collar industries. We really want to get to the employees that aren't on the health plan. That's where we can make the most impact. We're not necessarily constrained to group sizes. You might want to consider including Upland in your new and renewal proposals, or even consider a whole block overlay. We're doing lots of those types of proposals as well. Now, for my Jerry Maguire friends, let me show you the money. As I mentioned, there is a commission baked into all of our fees for our producers. We'll share 10% of what we make with you to thank you for bringing clients to the table. For single employer groups, we've often quote a value-based pricing model, a percent of savings with a capitation. We find that a lot of employers and producers like the idea of, hey, you only pay Upland when they can create savings for members. But as we moved into larger markets, jumbo cases and block transfers, we realized we needed to get to a per employee per month type of structure as well with a guarantee of savings. So we are welcome to work with you on the opportunity that you have in front of you and where you feel Upland will be a great fit, and work on the right pricing to fit that opportunity. What I'd like to do for everyone on the call today is run a custom analysis for you to see what Upland would look like on your client or prospect. I will follow up with what I need on that census, but when I can get a salary census so we can look at eligibility within a group, I can look and determine, well, my team will analyze who's eligible within that population for hospital bill relief, and we can separate it by full free care or partial care. We'll then look into project what savings we think as our Upland team with our skill set can bring to that employer population. And last, we'll lay over our fees and show you what the commission looks like on that opportunity. So the custom analysis is really what pulls this all together and allows us to tell that compelling story to you and your client of how we can help. Now, I know Krista mentioned she's going to send up a follow-up email, but please take a note of my contact information. If we're not connected on LinkedIn, please reach out. I would love to connect with you there, and for sure follow our LinkedIn page on Upland Advocacy. We're going to be launching education and awareness campaigns, and I want you to have a front row seat. I appreciate your time today. I hope this information was helpful, and I look forward to continuing the discussion.